say?
Can you guys all say Team Say on 3? 1, 2, 3. Team
Hi, I'm Mariann. Welcome to Teen Say. Today we have an incredible special for you. We're at Nova Prime and we're going to find out all about physical therapy and the reasons we need physical therapy, how to become a physical therapist, and how firefighters deal with injuries, and why they are the only profession that works out every day. I used to tell my husband, who is a firefighter, well, I don't get paid to go work out at work, but there's a reason for it. So we're going to tell you all about it. So, as you all know, I'm the producer of Dr. Libby's World of Medicine and Teen Say for the past 30 years. Without public access, we would not be able to do these shows. Feel free to look into public access to become a producer and do your own show. Get your own great crew. I have a great crew here today. And not only that, you can go to field shoots like we're here at their studio now, at their PT facility, or you can do them in the studio. Lots of fun. So, without further ado, we are going to start the show. So we are at Nova Prime. Why don't you guys introduce yourselves? Thank you for having me out today.
Thank you. Of course, thank you so much, Mariann, for having us here. My name is Shetal, and I'm a co-founder of Nova Prime Physical Therapy. And we started this clinic about a year and a half back. And I'll give it to Cruthi from here.
Hi, my name is Cruthi. I'm also co-owner of Nova Prime Physical Therapy, and thank you so much, Mariann, for coming here.
So there's a reason why I was so interested in physical therapy. Being a producer for Dr. Libby's World of Medicine for over 8 years and having top Washingtonian doctors, we got to know a lot of the area, a lot of the PT studios, and a lot of PT studios have backups for like months,
Right.
and they don't get you in. So I love the fact that you always help people get in no matter what. I think that's really good. But, so could you tell us, so if somebody, let's say, doesn't have a prescription,
Sure.
and they're in a lot of pain,
Yeah, sure, definitely. Yeah, of course. So a lot of people don't know about this, but that's actually a myth that you have to see a doctor in order to start your physical therapy treatment, which is not true for many states. It goes from state to state, but as we are talking, we are in Virginia state. So for Virginia state, we don't need a physical therapy referral to see a physical therapist. So if you feel like you are
30 days.
for 30 days, yeah, I was about to go.
Oh, okay. Sorry, go ahead.
So that's okay. So yeah, you don't need a referral to start physical therapy, but you can always start a physical therapy if you feel like you are in pain and that is something within a scope of physical therapy. You're tired of taking your medicines and you feel like you are not moving better, you don't have enough strength, you are hurting, which is not going anywhere. The pain is so bad that it kind of interferes with your daily activities. So there is the physical therapy comes. You do not need a referral. You can go see your physical therapist as long as your insurance kind of is within a network. You do need a referral after 30 days of starting a physical therapy though, which is also kind of varies from person to person.
When you say referral, you mean like a doctor's order?
Yes, exactly. So
Okay.
doctor's order. There is an alternative to that as well. If you have a primary care doctor, we can send a report, like your progress report after 30 days of starting your physical therapy, and they would kind of go over it, and then they would sign it back and send it over to us. And then it kind of works that way as well, so you might not need to visit your doctor at all in the course of your treatment if that's what you're looking for, like to just get started with therapy and complete therapy and do not go and hope around seeking treatment that you need, So yeah, that's very possible. Yeah.
And sometimes you can get better within 30 days.
Exactly. Yeah.
Yeah,
You do
like
not
if you,
always-
like let's say the races, it's so nice out now, so everybody's
Yes.
doing
Yeah.
the Ironman, the Spartans, the
Yeah.
Color and Motion,
Yes.
whatever other races, and they're
Exactly.
biking and they pull
Yeah.
something, they're running.
Yeah. Exactly. That's absolutely correct. Yeah. So not necessarily every time you would need a referral for, treatment for more than 30 days. Sometimes people come for once or twice, even 2 weeks or 3 weeks, get fix with their like injuries or learn what they need to do. We give them nice home exercise programs.
Yes.
And they're good to go from
How
there.
do you know if they're
Yeah.
not doing their home exercises?
Oh, yeah, we can tell. Yeah. So, yeah, we do use our assessment protocol in a way that we have to do some progress report every couple of visits. In our assessment or the first visit, we evaluate patients or a person's range of motion, which is like how their body is moving or how their injury part is moving, how their strength is in a certain body part. We do a couple of special tests, which kind of tells us what's going on with their body. We do regularly check on that, and then every session we assess that again, like how they improved from the last session.
Right.
And from that, we can tell, okay, if a person did their home exercises or not. So to answer your question, yes, we do know that from how they are improving.
So before I forget, two notes on that.
Sure.
So when I had multiple myeloma,
Yeah.
and they said, the doctor said when we went in, the director at Fairfax with spinal whatever, he said, I want you to go into the physical therapist.
Sure. Yeah.
And I said, no, I can't. I have to, I can't go out.
Yeah.
And he said, I want you to.
Yeah.
And it actually is better because, number one, as we're standing here, we have all the equipment.
Yeah.
We have these great balls, which, believe it or not, a simple exercise for me is just sitting in a chair and pushing this big ball. And yes, we can get it at home, but you know, the atmosphere here, they have their heat and so forth. So if the doctor tells you, don't fight them. I mean, I think coming out is good for your spirit, and also the fact that you have more, more equipment to use than you would at home.
I would reiterate that fact, yes, exactly. So the purpose of physical therapy is, I would say, yes, it is a skill therapy. So you would be able to get the guided kind of instructions, like how to do exercises, how to do your routine, or how to do your workout. So sometimes people tend to underdo or overdo things, and that can be a real problem. So there comes the skill therapy. We kind of guide them through a routine custom tailor program for yourself, which kind of helps you the most.
When somebody comes to you, right, so as I was saying, like coming to the physical therapy studio, is that
clinic studio?
Okay.
Yeah.
And they come without an order. How do you know?
Yeah.
Because they might come for arthritis.
Sure. Yeah.
They might come for, just a pull or sprain. They jumped off the monkey bars. Because you see kids also, right?
Yeah, we do, yes.
Okay. So when you manually do your first exam, how do you know whether it's muscle or a bone?
Yeah, that's actually a very good question. So there is a couple of different ways we know that. If there's a very fine line to know, especially if it's in your ankle, for example, ankle injuries are very common in kids as well as adults or sports people who are doing races and stuff, biking, running, anywhere. Ankle sprains are so common. So it's a very fine line, you could tell that. But the main difference I would say is like a patient or a person, whenever they hurt their bone or if there's a crack, even the slightest crack, they wouldn't be able to take any weight on them, Yeah, versus there's a sprain, even if it's a bad one, they would be able to take a little bit of weight on them. We also do a lot of assessment in the clinic on the very first day. We check their movements, their pain levels, swelling, inflammation, and if we have any doubt there, we do send them for an x-ray just to clarify. Most of the
Can you order an x-ray?
Well,
or you tell them, tell them to go get an x-ray.
We do, yeah.
Yeah, okay.
Whenever that's a case, which is not always, like maybe 5% of the people who come directly would need x-ray, I would say. Most of the people would know right away if they need an x-ray because it's so bad, they know something is really wrong with their bones. But whenever they are in doubt and they come to therapy, most of the times it's like ankle sprain versus fracture. But again, it's not possible that they don't have a fracture.
Right.
Sometimes it is, and we do send them for x-rays then.
So
Yeah.
as far as the massages, it's not a regular massage. It's like a technique. What is it called?
Yeah, it's called manual therapy techniques, where physical
Does
therapist-
everybody have a different technique too? But I
Yeah.
do want to hear about
Of
that.
course, yeah, sure. That's a very good question. Yeah, I would say yes, all the physical therapists do have their own techniques to do manual therapy on a patient. Well, it also depends on a person to person and also how they get trained for in their schools and their expertise, experience level as well. So, yeah, but that's a very good question. So
Do you
manual-
two use different techniques?
Yes, absolutely, yes. We would use different techniques. I would focus more on trigger point release, some dry needling as well. I would focus on some cupping therapy as well, which is a little bit different than the manual therapy, where we use like a suction cup to help relieve the pain and pressure and trigger points. And Cruthi would use some different techniques as well.
Do we want her
yeah,
to-
Of course, yes.
I would use sometimes manipulation, mobilization, soft tissue and deep tissue massage. Not massage, but it's like a
Therapeutic massage.
therapeutic massage. Yes.
Yeah.
Yes.
So yeah.
Okay.
And
So they
sometimes-
can't go to a regular massage place and cure an injury. They have to see. There's a difference
So
between
sometimes
a
we-
masseuse and
yes.
a physical therapist.
Yes.
How many years does a physical therapist go to school?
5 years.
Okay. And do you study medicines as well?
Yes. Yes.
Okay.
Mhm.
So go ahead. So
Yes, so we have been taking all the basic like
So for the schooling here, you would have to do your bachelor's. That would be preferable if you do it in science background. That would make it easier.
So you don't
to
need as
get-
many prerequisites.
Exactly. Yeah. Some of the bachelor programs do require that you take undergraduate courses in a way that kind of aligns with your Bachelor of Science degree. So after you complete your bachelor's, you would apply to a Doctor of Physical Therapy school, which is a separate 3-year program. The acceptance rate in that school is a little bit lower, so you would have to kind of know, like if you want to do that, you would prep yourself from your high school itself, so that way you have easier when you go into your Doctor of Physical Therapy school. After you do your school, you have to take a National Physical Therapy Board's exam. After that, you would get a license to practice in that particular state. In United States, all the states do require a license to practice. So it's kind of a little bit lengthy process, but it's very rewarding. You get to
So
see the
essentially,
people.
you're doctors.
Yes, exactly. Doctor. It's called Doctor of Physical Therapy. Yes.
Okay. Okay.
Yes.
So what if a person isn't comfortable with the technique? They're feeling a lot of pain.
Sure.
Might they need another physical therapist that does a different technique, or?
Yeah.
I mean, could that happen?
Sure, yeah, I mean, that's possible, yeah, that could happen. So, not necessarily they would always need a different physical therapist. So, as a physical therapist, even one single physical therapist can perform variety of techniques on you. Some of those might be painful, which is not
No pain, no gain?
No pain, no gain. Yes, exactly.
Oh.
Again, they monitor that pain, and then on the next session, they would talk with them how they tolerated their pain, and they would change the techniques for that particular patient if they don't feel comfortable. So it's kind of, like watching and waiting how they respond, and then like changing according to patient's need, and then it's different for each patient. You know what I mean? Yeah,
Right,
yeah.
right.
Mhm.
Do you want to add on that, on the techniques? Will you know if something's not working for one of your patients and just change techniques?
Yes, definitely. Every patient has a different kind of tolerance. And
Threshold,
their,
yeah.
Yes, threshold, and their strength and mobility is different. So we can just adjust according to their tolerance. We need to sometimes modify our techniques, and we sometimes need to modify our treatment plan too. So based on the patient's progress.
Right. And then the other thing you guys do is heat and ice, which is great.
Yes.
That's after.
Yes.
And that's again with the multiple myeloma, I think I missed out on all of that by not coming to a physical therapy place thinking it was easier to do at home, and it's not. It's a lot.
Sure.
I'm doing so much better now that I went to you guys, you know, so.
Thank you.
You're welcome. So I don't do all the things that you mentioned. Could you tell us a little about,
Sure.
in fact, let's go see it. There's a machine she uses, and I don't know what it does. It's
Yes.
the
Electrical stimulation machines, yes. So basically those machines have different functions. So we do use it for pain, for a lot of people who come with acute pain, strains, sprain. Even after surgery, people are in a lot of pain. They are not in a state of performing any of the exercises, so that kind of helps with easing the pain. After surgery, sometimes patients have not really well muscle control. They are not able to work their muscles, you know what I mean? So that machine has a different setting that we can use that kind of helps stimulate the muscle, and then you can get that muscle working a little bit better. Their brain kind of establish that connection, how to use that muscle again.
Yeah.
So that's another use for that machine. We do also have ultrasound techniques that we use for certain kind of inflammation. We call it tendinitis. So we have different types of machine, plus the heat and cold that you mentioned.
What
which
was
is
that?
everybody's
What was the other one?
ultrasound.
Ultrasound.
Yes.
Okay.
Yes. So there is therapeutic ultrasound and there is diagnostic ultrasound. So what people hear about ultrasound is mostly the one that is used as a diagnostic ultrasound, which kind of tells you if you have any injury to your muscles or ligaments or anything.
Right.
The ultrasound that we have in physical therapy, it's the therapeutic ultrasound. It's the different wavelength of ultrasound that we use to reduce the inflammation in your muscles or tendons or you know, like joints. So it's kind of different ultrasound that we use. Yeah.
And then there's cups. What is that?
Oh yeah, sure. So cupping
So many
that's very
things.
interesting. Yeah, exactly. So cupping therapy is very interesting. It's becoming more and more popular these days. So it's basically used for a trigger point release. A trigger point is a very high tension area in your muscle that you touch. It's gonna be so painful. A lot of people have it from overuse, posture, stress is a big one as well.
We're going to get into that.
Exactly, right? Yes. So those trigger points are very hard to get rid of, and cupping therapy is very helpful with that. So cupping is basically a circular cup-like device that you use to create a section between the cup and the skin and the muscle. So it kind of improves the circulation in the local area of a trigger point, which kind of helps with bringing the tension down, improving circulation, reducing the pain, inflammation in that area, and that kind of helps with improving the pain levels and the flexibility of that muscle. So that's what cupping therapy is.
So not to, you know, beat the horse, but can you bring all that to a home?
To some extent. So there are some devices which are portable ones, which won't be, of course, similar to the ones that we use in the clinic setting because of the space and the, you know, like the weight and the connections that we need. But there are some portable ones that you could use at home as well. In fact, there are some that you could use at home by yourself that are available in the market.
I've seen those, everybody has those. After the races, they have those big boots on and they vibrate.
Compression and vibration.
Yes,
oh
my gosh.
Yes.
Yeah, my daughter always sends me pictures of her with those big boots.
Those are fun, yes. It feels good, I mean, you know, especially after the games and race and stuff. Yeah.
And they're always there with, at the races, you know, with selling the massage chairs, selling the, I guess the vitamins that all of a sudden fix your, you know, muscles and all of that.
Yes.
My gosh, so much out there. So much out there. So I have a few questions for you guys about. We'll go see the machine and then we'll sit and we're going to show that backboard too of something. But I want to talk to you about. We just had Women's Day.
Oh, yes.
And I want to talk to you about stress and the different hazards of being, you know, in certain careers. And we want to talk to George, the firefighter. But there's one career that I think takes a backseat, which I know you're both moms and you can relate. Being a stay-home mom, you never, ever sit down. Ever.
Exactly.
And that's a lot of stress. And that's we're going to talk about what you talked about with what teachers have and what they're prone to, or you know, maybe then that's
Yeah.
what moms are prone to as well.
Yeah, of course,
Yeah.
of course. So
And then there's another therapy you do here. We'll get into that. But let's go see this machine. So we are here with the wonderful machine.
Yes.
What is it?
electrical stimulation.
Okay.
Yes.
So your lovely partner Cruthi has agreed for you to
Yes.
show us how it
Zapper.
works. Zapper. Okay. Ow. Does it hurt?
Oh, it kind of feels nice when you have pain. Yeah, we do it to a level that a patient feels comfortable.
Okay.
And when they are done with that, they really feel relief, or I would say reduced pain levels with a little bit better mobility as well. We like to combine the stimulation with either heat or cold,
Okay.
depending on what type of injury a patient has. So it kind of adds benefits of that. So
Okay.
it's kind of
Show us.
to wanna. Oh yeah, sure, of course.
And then
So-
dry needling. Are you going to show us that too?
Yeah, that would be something interesting.
And then we'll
yes.
hear about that. Okay.
Of course,
We're ready
yes,
to see you
yes.
zapped.
Yes, exactly. So these are the electrical stimulation patches. So this would be the position for a patient who has like tennis elbow or elbow pain. So
okay.
we would put them around the injured area, and then I would turn the machine on a different setting in a way that kind of helps her pain level to go down. We usually do it between 10 to 20 minutes based on what a patient needs, and we combine it with a heat or cold, like I said before. So
Okay.
that kind of adds benefit of that. Now this machine also have different type of functions. Like I said before, we can do like a stimulation setting on that, which kind of helps the brain learn for if a muscle forgot how to work, then we kind of can do that with that machine as well. Isn't that cool?
Yeah,
Right.
yeah.
Especially after surgery, or
Yeah.
you know, with some people who have very low muscle strength, their brain kind of forgets how to work, and this machine can help.
So why aren't I
retraining that.
doing this? No, I'm joking.
Well, you got pretty good muscle control, so
Awesome.
yes. But yeah, and then another thing we do with this is ultrasound as well. There is some
Oh.
separate setting on that we can do that to do the ultrasound treatment as well. Yeah.
So ultrasound meaning you see on here what's
yeah,
in there?
Yeah, well, no, actually, this is kind of different ultrasound. It's like more therapeutic ultrasound. It comes with a different attachment that we have in the cabinet. So you attach that, and then you would do like a circular motion with that ultrasound probe, which kind of delivers ultrasonic waves.
You can
into
show us
your
that too?
muscles.
Good. Let's see you get zapped.
Exactly. Let's do that. Okay.
It's not really a zap, right?
Yeah.
You're not going to jump off the
No,
table.
it should be comfortable, not too high, not too low. It should be comfortable.
Okay.
Okay.
Do you want to hold the mic? And then you can give it to her? Okay.
All right. So I'm gonna increase the stimulation.
Are you dying?
And so she's gonna tell me when she feels comfortable.
Oh, it's based on,
Oh, it's based on a patient level, like it's based on a person-to-person tolerance. So every person has different level of tolerance.
okay.
So we always tell patient to let us know when the stimulation is strong enough, but
Okay.
not painfully strong.
Okay.
So kind of submaximal level. So that's what is the most beneficial for
Okay.
them, you know. So you tell me when for the
Sure.
Okay, this is a chance to zap her.
Hope you've been nice to her this week. She says she's going to bring you Starbucks.
Yes. Okay, you tell me when now.
Started a little bit.
Okay. Do you want me to increase a little bit
Yes,
more?
yes,
Sure.
yes. Okay, that's good.
That's good.
Oh,
you can
So you can lower it or shut it.
Yeah.
Now.
Yes, exactly.
I just
yes.
wanted to show.
Yeah.
But okay, you
It
can.
feels very good.
Oh, okay, you can leave it on.
Yes.
So there are many types of injuries that you see: car accidents, bikes, kids,
Yes.
women. So different professions. What would be for this elbow? What would be a profession that frequently gets that? Like,
Oh, sure, yeah. So a lot of people who work on computer could get that because of the posture, repeated use of the keyboard, repeated use of the mouse. So that's one of the
Oh.
profession, yeah. And then sometimes sports people who play tennis or golf, they would get that as well because they use their elbow a lot with the force to, throw. So those two are the main ones. But then again, some kids who play volleyball, they would be prone to that as
wow.
well.
A lot of people.
Yeah, people who
So what
climb
is it
ladders.
called? Tennis?
Tennis elbow and
Okay.
golfer's elbow. It's kind of similar. It's just
Did
in
you
a
ever get
different
golfer's
location.
elbow?
So it's kind of in a different location.
And climbing?
Climbing could get there,
Okay.
not very frequently, but if a person is doing a lot of climbing using their arms a lot overhead, gripping very hard, then yes, it's not
Okay.
complete.
So that could be an injury for one of the races because they do a lot of that.
Of course, that's true. Could be.
Okay.
Yes, possible.
Okay.
Mhm.
So there's many professions, and some are just more prone to certain
Sure.
injuries.
Yes.
What do
Yeah.
you see? So that's computers. What
Yeah.
else, since the majority work on computers daily,
Yes.
what other injuries do they seem
Injuries?
to get?
Sure. So a lot of people who work on computer, they tend to work on computers for at least 8 hours a day. A lot of them are forgetting how to stand up and walk around in between.
What if they sit on one of those balls and
That's a very good one, but again, it has to be like changing positions, which is very important. The
Okay.
purpose is to distribute the pressure that you are putting on your spine and not put a lot of pressure on one portion of your spine at a time.
Right.
So we would always advise people to stand up and then get around, move around every 30 minutes at least, that's very beneficial. There is also like standing sitting desk available in the market, which would
I was going to ask you
yeah,
that.
that's a very good tool. I love it.
A lot of offices supply that now, the
They do
standing up
cover
desk.
it, actually.
Yeah.
Some of the insurance, to my surprise, are also starting to cover that, which is a very good step.
Yeah.
That's kind of helping to prevent the back issues to a great extent. So that's a good one too. But yeah, so a lot of factor in that,
And a
But-
lot of people should just get up and go walk.
Walk, yes, exactly.
Yeah.
We would always tell them to stretch after every 30 minutes or an
Wow.
hour, just to stretch out their neck a little bit, just to stretch their back a little bit. That kind of helps preventing the pressure buildup on those muscles
Yeah.
to a very great extent. So that's very important. Also, you get more circulation. It's good for your heart health too. So those type of things are very important. Small things, small changes goes a very long way. But yeah, to answer your question, those people would get a lot of neck and back issues.
Yeah.
Because of the posture as well. When
Right.
they're working, they're so much focused in their work. Sometimes their posture kind of tends to go rounded posture, forward head posture. That kind of
The
puts a
phones
lot-
do that too.
Phones do that. That's a very big one. I was going to go on that one. Yes, very big one. Yes, exactly.
Everybody's
So
always,
everybody's
we saw
looking
people
down.
walking in DC on their phones just
Yes.
I'm like, how do they do
How
that?
do they,
They're gonna
have, like ice here?
bump into people or poles.
Exactly,
Yeah,
that is
yeah.
very true. But yeah, so those type of injuries are very, very common, neck issues, back issues, and then shoulder issues as well, I would say, because they kind of rotate their shoulder when they're typing or using their mouse a lot with a lot of
you know
movement,
that?
horizontal. So yeah, those type of injuries are very common. We do see them every day, at least couple of people walking in with those type of injuries, yeah.
And you can just pop by physical therapy and get fixed and told you need to exercise. So what about teachers? Tell us about teachers.
Sure, yeah.
And how,
teachers-
and stay-home moms.
Of course, yeah. The teachers and stay-home moms, yeah, they tend to, I would say, be on their feet a lot, whether it be standing or walking, helping kids with a lot of things that kind of similar in nature. So the injuries that get more is the feet issues and the back issues. So when you stand on your feet for a very long time, especially if it's a hardwood floor or not enough cushion on your foot, your fascia at the bottom of your foot, which is called plantar fascia, kind of gets very tight and inflamed. So it's called plantar fasciitis. So they do tend to have pain in their feet, which they feel like, okay, it's just because they're tired or have been on their feet a lot, so they don't seek help immediately until it's very later in the stage, which kind of makes it a little bit longer treatment, rather than treating it initially when it's in the beginning phase, So plantar fasciitis is very common in those
So
type
would
of
they see a
people.
physical therapist for that or a podiatrist?
They do see both,
Both?
kind of. They
Okay.
can come to directly a physical therapist if the issue is not as bad, but if the issue seems to be a little bit deeper, then they might need to see the podiatrist for getting more diagnosis done, Yeah.
Right.
Yeah.
And the stay-home mom?
Yeah, of course. The
This is-
stay-home mom kind of similar issue as well like as the back issues as well. Sometimes
Oh yeah, lifting the
the
kids,
kids, laundry,
the baby.
cooking, and then a lot of things come with the back issues as well, like neck issues as well. So yeah, the back one is the big one. We did have a couple of moms come into the clinic walking in with back spasms, which is
Oh.
from lifting or twisting suddenly, which kind of happens if you already have some back issues going
Yeah.
on from a long time, and you kind of
Yeah, you're lifting
do much-
laundry.
yeah.
The baskets are heavy. I noticed
Those
when
are
I had the
heavy.
multiple myeloma.
Exactly.
Even putting the dishes in the cabinet were very
Yeah,
difficult
Exactly.
when
So
I
they-
was hurt. Yeah.
Exactly, yes. So those type of small things builds up over time and then
Yeah.
cause issues, when the threshold is reached, you know what I mean?
Yeah.
So, yeah, unfortunately, yes, that's what happens. But if you notice those in the beginning, then it's kind of very helpful and very easy fix.
Yeah.
Yeah. Mhm.
So firefighters,
Yes.
they are on the go, and
Yes.
they are the only profession
Yeah.
that I've heard of. There might be more,
Mhm.
but that are paid during their workday to do,
Yeah.
physical
Of course.
physical activities,
Yeah.
PT,
Yes.
working out.
Working out.
So that used to be a joke with my husband and I.
Yeah.
I'd say nobody pays me to work out.
Work out. That's true.
So,
Yes.
but I'd like George to come up, and
Yeah.
he went to Germany,
Oh, yeah.
which we have a piece coming
Yes.
out on that as well.
Okay.
I followed his journey,
Mhm.
and he did a lot, but we'll ask him about that. But I want him to talk to you about certain injuries that firefighters seem to
Sure.
get.
Yeah.
Do you get a lot of firefighters?
We do get some, yes.
Yeah, I met one the other day. That's right.
Exactly.
So George, you want to join us and talk about firefighters? So we're talking about injuries and different professions. So thank you for joining us, George, my husband.
Thank you.
So you were just retired from being a firefighter, and EMS Captain
Fire
2.
EMS,
Yep. So I think some of the injuries too are lifting, right? Because
Oh, absolutely.
nurses have that issue too. So
Yeah.
why do firefighters work out every day?
Well,
Everybody should, but why do firefighters get?
it's a must.
Okay.
It's a must. Imagine some of the points that you mentioned about
Stress.
workers at a desk, right? If the body's not in motion, it becomes, let's just say, stiffer, tighter, and let's just say
Sedentary.
less juice. The juice that's in our body that keeps our joints active, lubricated, dry up, seize up, and are not active. So while we're young, we don't realize how critical that is until, one, you've had an injury, or two, you age and you've been in a profession for a while. Desk work for a young person, not a problem. They could probably go 10 years, 15 years, no problem, right?
So what I'm asking is, so why do you guys work out every day? Just to keep the muscles moving?
Absolutely. Keep the muscles
Excellent.
moving, strength, so
So-
that you mentioned stress. Stress is another thing that exercise helps overcome stress.
Yeah, seeing dead patients, people screaming and crying.
All versions, chaotic events.
Yeah.
The idea is there's a physical part of it, but there's a mental part of it. And by increasing your cardiopulmonary effort, right, as well as the physical aspect, you're able to endure, let's just say, spikes in events that occur.
Could you tell Shetal, like, what kind of injuries you had and how PT has played into your life? Or
PT is almost like a daily necessity. Because post injuries,
Yeah.
it was one of the requirements to get back to a functional capacity, right? Because you lose during that time
Exactly.
the strength and the mobility just because of the pain, whether
Yep.
it's the muscle, bone,
Muscle. Yeah, exactly.
or
Yeah.
disc.
so how did you get injured? Like, what were a few injuries?
A few injuries earlier on were neck injuries, back injuries. Back injury was just caring for a motorcycle victim. So at that particular time, it was a supervisory level. So I found myself doing more supervisory things behind the computer prior to that, I was not behind the computer as much, and I was more active. And I found myself transitioning between supervisory stuff that kept me behind the computer, and then changing, having to do the physical stuff that I did.
Yeah.
And that's where that crossover, it was a mismatch, because it just
Yeah.
precipitated that back injury.
And then, so what surgery did you have in Germany?
I had.
It requires a lot of PT.
So,
Oh, yeah.
So, in essence, with a lot of the weight bearing and with a lot of the, let's just say, sometimes stepping, jumping, lifting, your disc take the brunt of it. Some part of your body takes the brunt of it, whether it's your joints.
He's had a lot of
Or your
injuries
disc,
over
right?
40
Yes.
years, but he loved it and just
Loved it. And
kept
you-
going back.
That's so nice of you.
It's the same thing with, you mentioned the love for whatever you do. That's what I see in good practitioners within the physical therapy arena.
Yep.
That
Sure.
if you have a deep passion and
Yeah.
love for it,
Exactly.
you understand
Yes.
the body, right? You have a visual understanding of how every muscle group
Yep.
works and what needs to be
To be
manipulated.
done. Yes.
And
Exactly.
it is,
Very important part.
oh my
of
gosh.
The treatment.
Yeah,
Yes.
oh, absolutely.
Yes.
But anyway, to get
So
back,
you had 4, tell us what you had in
Yeah.
Germany
Yeah.
that you couldn't do in the United States.
so I had 4 levels of disc actually removed and a implant put in.
Called an M6.
M6. Yep.
4 of them.
For that.
And they
then,
moved like 6 parts of the body. Like,
So 2 in the lumbar, and then 2 in the cervical area, and then 2 other additional procedures done there, and that
The
was all
cage.
within 5 hours. They did that.
Wow.
and
Okay.
all
That's,
that. Same
they can
time.
only do
Wow.
1 level or 2 levels
Yeah.
here.
Yeah.
They did 4 levels
Everything's
there,
the
a
same.
cage and something else.
Yep. Coflex.
Coflex.
Basically, it's basically like a shock absorber, so that it doesn't it prevents the wear and tear
Coming
of the
onto your-
following
Yeah.
disc
And yep.
that's below
And
the
the
area
bone,
of
yeah.
the
Operated area.
Yes.
Yeah.
Yep.
Yep.
and so I've had one of the nicest things about that is that they required massage, because I find that's one new thing. I think the combination of both I
Yeah.
think was the success, because
Yeah.
one can do one aspect,
Yes.
right, and understands
Exactly.
the need. The other one kind of calms everything down.
Down. Exactly. It's a win-win situation. They both kind of work together
Yeah.
to help you get where you need it to be.
Yeah,
Yeah.
yeah. And before that, the only prescribed practice
Yeah.
typically in America was just physical
Yep.
therapy. To
Right.
do a massage, you would have to go out on your own, and to have a massage was like kind of like,
Yeah.
it's not even recognized.
Yeah.
And I don't think that's a wise focus for
Yeah.
total recovery.
Recovery. Agree.
So,
Totally.
so the M6s are devices that actually, what I was saying is they make your body move in 6, like they have
Yeah,
6
yeah.
motions.
Right. So
What are
it
the-
replicates exactly what
Like
a
it's not a
natural disc
fusion.
does,
Yeah.
right? And so you're able to do the lateral extension, flexion, lifting, jumping, all those things, and what you could do prior to the compression of the disc and the impingement on your spinal
Cord and nerves. Yeah.
nerves.
Yeah.
Tell us what kind of injury stress can cause.
Yeah, sure. Stress can cause basically literally anything. Mental problems, physical problems. The big one I would say stress can cause is a posture change. So a lot of people tend to change their posture when they're stressed out. Forward head is very common, rounded shoulder is very common, arched back is very common.
Yes.
But yeah, stress can do a lot of things to your body. Everybody carries stress on the different areas of their body. Some people would carry on their neck, some people would carry on their upper back, some people on the lower back. Some
Okay.
people tend to clench their buttocks when they are stressed out, which causes like hip pain and back pain.
Wow.
And so it really depends on person to person. So basically, stress can cause pain in anywhere in your body, whether it be neck pain or shoulder pain or back pain or hip pain. Anything can happen from stress. So first thing you do, relax, do some breathing, take time out for yourself. 5 minutes breathing every morning helps a lot, big time.
Breathing, just regular breathing?
Just deep breathing, I would say.
Okay.
With a little bit of meditation, if you can add that to the breathing technique. I would say breathing in from your nose, breathing out from your mouth, closing your eyes for 5 minutes does wonders to your body.
They have
Yeah.
that on the Apple Watch. It tells you to
Yes.
breathe for a minute, right?
Exactly.
Yeah.
That's the reason behind it. Yes, exactly.
Okay.
Yes. Uh-huh.
So we know that physical therapy can
Yeah.
fix a lot of injuries and so forth.
Mhm.
There's one that women go through
Yeah.
that the teen girls will know nothing about this
Yeah.
and might get a little scared, but in the
Yeah.
older age, women have problems.
Yes.
What
Mhm.
kind of problems do they have that they
Sure.
require the therapy that not all therapists do, but you
Yes.
guys do it?
Right.
So what is that therapy called?
It's called pelvic floor therapy.
Okay.
Yes. Uh-huh.
And why would they have to do that? What would they be
Sure.
experiencing to know they need to do that?
Yeah, that's a very good question as well. So pelvic floor therapy is basically requires not only the woman but majority of the women and sometimes men have that problems as well. So basically it ranges from a variety of conditions. You could have pain in your pelvis, you could have back pain, you could have difficulty with going to use the bathroom, going to pee, or going to number two. So there is a variety of problems that you can have that you need to address with the pelvic floor physical therapy. And like you said, there is not a lot of providers available.
Yes.
And that's the biggest problem.
Right.
We do provide pelvic floor therapy, and me and Cruthi, we both are on our way to get board certified pelvic floor therapist, which is like very few number of therapists available in the whole United States. So yeah, basically, thank you. So basically, whenever we get pelvic floor patient, their first complaint is, you know what, it's very hard to find a pelvic floor therapist. And we didn't know sooner enough to know that we need that therapy, and that
Okay.
kind of leads years and years of damage in that area, and then the treatment becomes a little bit more, I would say, not complicated, but a little bit more attention it needs then. So statistically, like around 30 to 40% of women goes through these problems after delivering a baby, which is a quite huge number. So
Yeah.
it should be a part of regular treatment after they deliver a baby.
How do they
That's
know, the
what-
young girls?
Yeah, so unfortunately, that's the thing. They don't know until they go home, and then they find out that they have that leakage while they go
Oh.
to pee, or even after peeing, or in stressful conditions. They would, like when
Sneezing, coughing.
sneezing, coughing, jumping. They're playing with their baby. They have to carry their baby.
Right.
So those type of things they don't realize until after they go home.
Yeah.
And they feel like, okay, I'm taking care of my baby. I don't have enough time to, take care of myself now. That kind of gets stretched out for months and sometimes even years. The other day I had a patient who came in after 9 years of delivering the baby, and
Wow.
those type of things are not
Isn't it too
uncommon.
late then and they have to do surgery?
No, not always. It really depends on what a person has.
Because then they get a sling if it's so bad that
It's
the
so
urine
bad.
is so bad. Yeah.
Yeah, so there is a
I did my homework.
You did it? Yes, exactly. So there's a couple of things that could happen there. One thing is the muscle weakness in your pelvic floor area that is very easily fixable with the strengthening and retraining your muscles, retraining your core and stuff like that. There is certain other conditions which would require surgery, which is not in every case. I would say like maybe 10% of the people,
Okay.
depending again on the diagnosis what they have, would require it. But even after years and years of having the problem, that is therapy. Pelvic floor physical therapy is something you could do to help yourself
Yeah.
get better, so you don't have to be in the embarrassing situations to go out and having to worry about that aspect.
So a woman
Mhm.
could contact a physical therapy office just the same with an injury without a referral and
Exactly. Yes.
see what you guys say. And
Exactly.
right.
Yes.
we won't get into what the treatment is,
Yes.
but we don't want to shock the teens
Yes.
too much.
Uh-huh.
But you also do something else that you're certified in. You're a
Mhm.
no?
Ergonomist. Yes.
Ergonomist. Tell us what that is.
Sure. So an ergonomist is a person who kind of evaluates your posture when you are working, your working conditions. Like, for example, if you are working on a computer 8 hours a day, they would take a look at your computer, the height of computer, the height of your chair, how you're sitting, you're resting your feet well, you're keeping your feet where it should be, you're keeping your arms where it should be, your head is aligned with your computer on a proper height.
So do
that
you
way-
have to go out to them to do that?
So there's a couple of different ways you could do that. You could always check on the short video that they can capture at home. You could check their pictures as well, like on their working conditions.
Okay.
And there's a couple of different ways we could do that. Or we could give them ideal situation and they can get adjusted to that and send us a picture of that. Hey, you know what? This is what my workstation looks like. What do you think? Because a lot of time correcting those small things, correcting or changing the height
Yeah.
of the chair, computers, adjusting the distance helps a lot with reducing the pressure or stress in the neck, shoulders, or lower back, which
Yeah.
helps in preventing injuries and pain, you know?
Yeah.
So it's a very important factor. Yeah. Mhm.
So this is the key?
Yes. Everything in this one.
I absolutely love that wall.
you.
I do.
Yes.
So thank you both for talking to us today and educating us on physical therapy and how important it is in our life and how accessible it is.
Yes.
And you guys are making a great difference. And one of your patients said that I was gassing you guys, which in teen terms, I guess I was pumping them up, but I wasn't just pumping them up. I actually had and have multiple myeloma. I'm in remission, but it's very painful. I walked in here today and I said to them, ow, I have to talk to my PT people. I need, therapy. So I think therapy is great and we really appreciate what you guys are doing. So thank you.
Thank you so
And they
much
have a
for-
lot of empathy. So thank you so much
Yes.
for educating us.
Of
And
course.
until the next show that we convince them to do on physical health or something, because Cruthi thinks Shetal needs to do more shows.
Oh my God.
Thanks for being here. You can catch our videos on YouTube. Go to www.teensay.net, hit our YouTube button. You'll see Dr. Libby's World of Medicine from many moons ago. Now everybody has their own website and medical shows, but we were doing it before them. And you've got Teensay, where teens are opening the communication lines with adults. So until the next time, thanks for joining us on Amazing Medical Mazes. You decided to come to Germany to have many procedures done instead of the United States because this many levels is not possible in the United States, correct?
I need more than one level in the cervical spine and the lumbar spine.
Why did you pick this doctor in Germany?
The most experience, the person that was actually involved in the design of the device. He helped Spinal Kinetics in this latest edition. His specialty and his focus has been this from early years, where he focused that with a number of German surgeons. Other TDRs, which is total disc replacement. Some coworkers also had great success. When we're saying great success, they weren't able to run, barely walk, some of them, and came back fully functioned, doing their normal activity. I've been a firefighter paramedic for a long time,
40 years?
almost.
Wow.
Yeah.
It's wearing on the back, huh?
It's wearing on the body, but when you do something you love.
Good morning. I'm here with Dr. Ritter-Lang, the most sought-after spine surgeon in the world. So how many disc replacements have you done with the M6 and before the M6?
Before the M6, we used a specialty, and so around 750 cases. Then We used the Maverick device with 1,000 cases, and so in summary with the M6, I don't know exactly, but I think 7,000 cases lumbar and maybe 4,500, 5,000 cases cervical.
What is the difference between a level and an artificial disc?
A level is the so-called segment between two vertebral bodies and the disc,
Okay.
the natural disc. That means that is a level.
Now you will do more than one level, whereas in the United States they will only do one level at a time, correct?
Yeah, that's correct, because of the FDA restrictions in the United States. Lumbar two-level disc surgery don't work.
Okay. And what is the most amount of levels you have done at one time?
Typically, we have a small number of patients every year. We do 3-level surgery in cervical, also in lumbar, but typically it's 1 or 2 level in lumbar and mostly 2 levels in cervical. Cervical is a little bit more.
So hello.
Hello.
I'm here with Dr. Spiller,
Yeah.
the best spinal surgeon in the world.
Thank you.
You're welcome. People come from everywhere, all over the world, to see you.
Yeah. That is
This is your book as well.
That is a book that Dr. Ritter-Lang and I wrote a couple of years ago, because we're in the situation to not to fuse a spine, but to come to motion preserving technique, and that developed over time. So we are doing this for 20 years right now, starting in 2003 in our hospital in Germany. And that's become to our brand, that we try to perform a motion preserving technique on the cervical and lumbar spine and to avoid fusion. But nevertheless, fusion is also a good technique in some indications. One cannot say that it's forbidden or something like that. The spine surgeons say that the fusion is a gold standard, okay? But the motion preserving technique is sometimes better for the younger people to recover, to come back to normal life quality, to get their profession, to get into the profession again and earn money. That's the main goal of all the younger patients that we have over here from the United States and Canada. And it's a long history, and it's sometimes a long way for the patient, but they find out. Over time, we had something about 2,000 candidates from the United States and Canada, and one can say we had almost every profession, from the helicopter pilot with a big helmet for the cervical devices to the fire workers also.
Yes, and now you're the chief surgeon at Stenham?
Yeah, I'm the chief surgeon of the hospital, performing knee and hip replacement, for example, and of course a lot of spine surgery.
I'm here with Colleen Gibson. Hi, Colleen. How are you?
Hey, I'm good. Thank you.
Well, I heard your name while I was in Germany from every American that I spoke to. And I said, I haven't met Colleen, and including my husband, George, as you know, who had the 6-level surgery in Germany, who you helped get there, and many other people. So you are the point of contact. You are there's another name for what you do. You are
a case manager for Dr. Ritter-Lang and Dr. Jan Spiller. Well, what I do is I'm sent a contact or I receive a phone call personally, as my website has my contact information. And then I assist the patient in gathering all of their images that they need and their data. They have to fill out their forms. They have to send their MRI and X-rays. I go over all that in detail with them. I assist them at getting all of their information to the doctors. And then when we get the actual evaluation back, I go over the evaluation to the best of my ability. Any medical questions need to be answered by the doctor. I answer the general questions, and I basically support the patient through the discovery of their actual condition, which can be very scary when you first hear about it. And since I've been there and done it twice, I know what they're going through, and I try and do my best to comfort them and assure them. And he is so humble.
He is so humble. And what I found fascinating, and we'll hear Hun, the massage therapist that comes to the park and helps them heal, which we'll hear about them all doing. Hun said, "Do you know where the master lives?" And I said, "No." He said, "Where Einstein used to live." And I said, "Makes sense. It makes perfect sense."
Oh, he's brilliant, and he's
Yes.
a perfectionist. I stood beside him in the operating room for a whole day. I watched the surgery he did on my lower back, and also watched the cervical disc replacement, which I also had done several years later on November 5th, 2015. I started having problems with my neck when I was out on my fishing vacation. And I didn't really clue in at the time that it was my neck. I thought I had done something to my arm or my shoulder, because I suddenly had this extreme pain in my left arm. And it got to the point where I had to leave the lake and go home. And I went straight to a walk-in clinic. And the doctor there told me that it was very serious, and they wanted me to go for an emergency CT scan right away. So I did.